Hi, I'm Dr. Jim McDonald, Medical Director, Rhode, Department of Health. I'm here with Dr. Phil Chan, Infectious Disease Specialist.
Hello.
And today we're going to talk about why it's important to be physically distant or socially distant from one another here. In other words, why we're more than 6 feet apart as often as we can. Dr. Chan, how does this SARS-CoV-2 virus that causes COVID-19, how does this virus spread?
Yeah, so it gets to the question of why 6 feet? Where did this whole 6 feet concept come up? And that's because the virus is spread mainly by droplet transmissions. So these are larger respiratory droplets. When you cough or sneeze, they're spread to another person. Good news is someone is further than 6 feet, these droplets will fall to the ground from gravity and won't affect someone else. So that's why the 6 feet rule is in effect. We also know, though, that the virus does spread somewhat by airborne transmission in rare cases. And airborne transmission are smaller virus particles that can kind of drift through the air, and those go further than 6 feet. So as we talk about social distancing, physical distancing, this 6 feet rule, 6 feet is good. It's the minimum, but certainly the further the better.
Yeah, it's interesting. You remind me that the virus actually comes into my body through inside my nose or inside my lungs. So when I see 6 feet apart, it's nose to nose 6 feet apart. And it makes me think about indoors versus outdoors. Like, where is it safer to be? Do you want to be indoors or outdoors? And quite frankly, I live in both. I think most of us do. And I think it gets to that point about there's a little bit more risk when you're inside a building. And that's because the airflow isn't the same as outside. And that's why masks are more important inside as well. And you know, I think it's just important when you're outside, you still want to be 6 feet apart. But when you're outside, there's so much more airflow. There's a breeze, you feel it. And that really does help things out a little bit. Dr. Chan, what are some other thoughts about being indoors versus outdoors that are important for folks to know?
Yeah, I think for me, it's one thing that's really been highlighted during this pandemic. It's the importance of ventilation in general and even being outdoors. I mean, we've started now recommending just the importance and highlighting of being outdoors. You know, when you're indoors, you have very limited air circulation. The filtration may not necessarily filter out the virus. So it's things we're looking at the indoor setting versus the outdoor. But at the end of the day, being outdoors is always best. And it doesn't have to be with these, you know, it can be as simple as opening a window, you know, opening a window in a car, if you're in a classroom setting, keeping the windows open, etc. So you don't need these fancy schmancy, huge ventilation units. A lot of times you can achieve the same effect just by keeping the window open.
So why do we have the dominoes on the table? So in Rhode Island right now, the social gathering size is 15. So just for the sake of conversation, so let's pretend we have two parties going on. We have this party over here. People are listening to the state's advice. They're all being 6 feet apart. Over here, we have another party going on. Dr. Chan, it's your party. And your folks aren't staying 6 feet apart. How do you explain this?
They're not. They haven't been listening to our guidance.
It makes me concerned for them. It really does. And part of why I'm concerned is, just say, for example, there's someone at each party, we don't know who is carrying the virus. They went to the party, they felt fine, they had no concerns, but they're pre-symptomatic. In other words, they're gonna get sick in a couple days, but they're still shedding the virus. Now, when they're over here at my party, just say it's this person here. If they're sick and they happen to cough or sneeze, nobody else gets so affected by it because everybody's 6 feet apart and it helps with them wearing their mask. But Dr. Chan, at your party, what happens to that guy right there? Just say he's carrying the virus. What's going to happen when he coughs or sneezes?
Let's take a peek. And I think it's important to remember, right, that up to 50% of people may be asymptomatic. Let's see what happens.
Yeah, see, almost everybody had a problem at Dr. Chan's party, so this is a concern. And this is part of why we want to stay more than 6 feet apart when we're in social gatherings. And I just think it's important to keep in mind, you know, the rules are different. And, you know, I'm thinking about that old expression, you know, if we don't learn from history, we're doomed to repeat it. And if we're not willing to live differently during the pandemic, we're doomed to perpetuate it. And one of those things about being 6 feet apart is you do really reduce the risk of you spreading a disease to others, but you also reduce the risk of others spreading the disease to you. This one is mutually protective, being farther apart. So quite frankly, right now, the only person who I'm ever within 6 feet of right now is my spouse. My kids, they're older. If we're in the house, they're doing their own things. We're not hanging out together, you know? They're not little guys. So I think that's just an interesting thing. All right, fair enough. What are some other thoughts about what a different 6 feet or more makes, Dr. Chan? What are some other thoughts about duration of time?
Yeah.
Does duration of time matter at all?
Let's talk about what is a close contact. So a lot of what we've been hearing out there from public health organizations and the media. So close contact, what does that mean? So it's defined as any exposure potentially to the virus. And the way that that happens is if you are directly exposed to secretions. So if someone coughs on your face, you would be considered close contact. The other way is that if you are within 6 feet of someone for 10 or 15 minutes plus, is that that's also technically considered a close contact. And I want to remind people that these are rough guidelines. So it's, someone had to draw the line at some point, 10 to 15 minutes. I mean, it's a little bit sort of out of the air there. So the point is that if you're within that time or longer of someone and potentially exposed, then you're a close contact.
Yeah, and you really get to that point too about why you want to keep your group generally small. And it's important during the time of the pandemic, when you're going to be physically with people, to keep the number of people consistent. In other words, a stable group of people. This limits the number of people you're going to interact with, and that's a little bit annoying, but it really gets to the point about we're less risk of exposing more people. This is part of why people are working from home right now. It's part of why other public meeting places are doing remote experiences. I know a lot of churches are still doing remote worship services. There's other ways to do things now that allow us to be physically distant, some of this infrastructure here. But you want to keep your group as best you can as a stable, smaller group, and no bigger than 15. It just makes it easier for you here. I think one of the things is the more people you're around, the more risk you get. And the more movement you have, the more risk you get. So, my kind of concept there is we should gather in smaller, stable groups and move less. I think it just reduces our risk here as well. One of the things that I think about when I think about the pandemic is how it spreads from person to person. Parties have been something we've noticed, and it sounds like I don't like parties, but I do. But one of the things we've noticed is when you're at a party, particularly with people who aren't wearing masks and aren't physically distant, we've really seen it spread throughout that area quite a bit there, so that's a concern. Dr. Chan, we're getting close to the end of our time together. What about this CrushCobot app? What should we know about the app?
Yeah, I'll start off by saying I think what you're highlighting, Dr. McDonald, which is great, is that it's not just one thing or the other. It's sort of all these different tools together, all these different pieces of the puzzle that come together to make someone safe. So it's partly about mask wearing, it's partly about the physical distancing and the ventilation, environmental cleaning, hand hygiene as well. So everything that we're talking about here is a piece of the puzzle in terms of defeating COVID-19. And if you want more information, the state does have this app called CrushCobot RI. It's free to download off of our website. It sort of goes over how these approaches work together, offers some resources. I do really encourage people to check it out. It has a free symptom checker, etc. So it's something that we have invested in at a state level. We believe that it works and it helps, and I encourage people to check it out.
So I want to thank you for joining us today. I'm Dr. Jim McDonald, Medical Director, Rhode Island Department of Health, and thank you for all you're doing to help keep Rhode Island safe and helping your neighbors understand why we stay 6 feet apart.